Welcome to my show, Dr. Robert Floyd. Floyd, right? And
Correct.
so all the time we talk about God in this show. God, second brain. And this time we're gonna discuss more how God and energy are related. Because I know a lot of people come to us about their energy. They are very frustrated. Every day you want to get up and you can't, and you think that there is something wrong with the flow of energy. You don't know, maybe you are depressed or something, but then when you go to the root cause, you see there is something wrong with your gut. All right, first you can introduce yourself to us. Tell us about your story. How did you become a functional medicine practitioner?
Thank you very much for having me here. It's a pleasure. I did. I originally went to medical school. I wanted to be an orthopedic surgeon, but wasn't cool enough to get in the club. And so then I did. I did 2 years of trauma surgery training down in Las Vegas, and then family medicine. And then I was an ER physician for many, many years. And I really enjoyed it. It's very varied. I did a lot of things, a lot of procedures, and having the trauma surgery background along with the family medicine background really gave me an edge on being a rural ER physician, and it really helped me be able to see, everybody from newborns. Actually, I delivered babies in the ER to old and dying and hospice patients in the ER as well. And I've also worked as a hospitalist, and I ended up kind of leaving the ER because I was traveling a lot and I was gone from home for a long, long time. And I went into an integrative medicine clinic, and that's kind of where I discovered functional medicine. I don't remember exactly how I came across the Institute for Functional Medicine, but to me that was kind of a savior because I was having some burnout working in the hospitals and the ERs, and the functional medicine paradigm just really helped me realize that, wow, this is great medicine and it's root cause medicine, and I can make a big difference helping people change their disease processes by going back to the root cause. And here I am today. I've fallen in love with what I do, and it's great. I'm very blessed to be here. So
Why do you think that God can be related to energy? And if you have any cases study that you could help, please let us know.
oh yeah, for sure. The all disease starts in the gut, supposedly, right? We know someone's famous who said that. But the gut is it's one of the most active organs you have in your body. The cellular turnover of the mucosal lining of the gut is about 3 days for all the cells to turn over, and you get all new cells within 3 days. It's a very metabolically active organ. And they're doing more and more studying about the microbiome and leaky gut and things like that, and how it affects hormones. And it's just truly, truly amazing. I really fell in love with learning about gut health in functional medicine, and also how it helps your energy, your hormones, helps prevent cancer, it helps nutrient absorption. You asked about how gut health can help aid or decrease energy. One of the things I've noticed is that our standard American diet, it's very highly processed food, it's high sugar food, it's low fiber, it is nutrient poor and calorie dense. And you get out of it what you put into it, and you are what you eat, right? And so if you're eating the standard American diet, which hopefully we can get people to stop doing that across the board because it's terrible for everybody's health. You have basically you will have intestinal permeability, or what's known as leaky gut. And a lot of people don't really know what leaky gut is, but it's when you have kind of a porous opening in the gut, and that allows food particles, bacteria, viruses, fungi, dirt, uh, um, and the breakdowns of bacterial called lipopolysaccharides to get into the bloodstream. And what this does, it actually causes a chronic low grade inflammation. And it's my humble belief, and that of many people much smarter than me, that this is what's leading to our chronic disease problem in America.
Do you have any case studies related to gut and energy?
Oh yeah, I mean, pretty much everybody I help heal their gut, they tell me straight up that their energy levels are better. I had one gentleman who he came in to me completely anemic. He had a hemoglobin of 6, which is so low that like he had to get a transfusion. And I um, looked at him and I said, you probably have celiac disease, because that's kind of a forbearance of celiac disease. It's kind of a foreshadowing. If you have anemia of unknown origin and you're a male, it's you got to check for celiac. So, and this gentleman, he's become a good friend of mine. He's really into riding dirt bikes and snowmobiling and skiing, and he came in and he said, "Doc, I don't have any energy. I can't get up and go. I can't do anything." So I ended up doing a huge workup. We got him transfused, and then we did a workup, and he was celiac. And I basically, helped him heal his gut by, removing uh, gluten, dairy, sugar, and just changing a lifestyle for him. And today he is active and vibrant and healthy. And he's called me many times and said, Dr. Floyd, thank you so much. He's actually literally told me that I've saved his life, and to me, that's just very rewarding. And that's just one patient, but the majority of patients I have, when we heal their guts, their energy levels just skyrocket, and I love it. It's really fun. I know, and for me personally, the same thing. When I have a good healthy gut, my energy's through the roof. Can't hear you.
Oh, sorry, I was
There
mute.
you go.
I said, what do you think is a difference when comparing yourself when you were a medical doctor, working in ER, and now you are doing the functional medicine?
You know, I love the fact that I'm able to have been trained in, you know, um, allopathic medicine. I stand on the giants before me. All of the great scientists and doctors that I've learned from. That we've all learned about in med school, and then also all of the. I really learned medicine like incredibly during my trauma ICU rotations and my trauma surgery. And, I got to give a shout out to all the trauma surgeons down at UMC Medical Center in Las Vegas. They really taught me about medicine, critical care medicine. And I believe that having that background, and then also then going into family medicine, it's really given me a very broad um, scope, and it's also given me the science background. But again, family medicine is also very um, compassionate and empathetic and caring, and it's really helped me in that aspect bring that to functional medicine for my clients. And because of that, I feel that what I have to offer is unlike most Western medicine doctors today. I don't want to say us against them though, because we got to bring them together. Western medicine, DO medicine, allopathic medicine, functional medicine, naturopathic medicine, Chinese medicine, acupuncture, all of this, health is multifactorial. That's how I look at it. And so I want to just make sure, like, if something else will work for someone else, then go ahead and do that. And that's my take on how medicine should be.
I guess one of the reason people want to go to functional medicine is that, first of all, the conventional labs are not optimal, right? The one you see is not in optimal range, and that may actually lead you to other wrong diagnoses. Or if you have the optimal range, before symptoms uh, show up, you can actually diagnose it or you can see the problem, right? So that's what I see in most cases that I have. Do you have any cases studies or anything that can elaborate on this?
For sure. One of the funny things about Western medicine is um, the thyroid panel, right? And the thyroid panel, and I'll see patients and they'll come in and they say that they're tired and they're gaining weight and they have cold intolerance, but they say that their doctor says that their TSH is normal. Well, unfortunately, you can't just draw a TSH. That's just a thyroid stimulating hormone. That doesn't tell you anything about your levels of T3 and your T4, your free T3, thyroid peroxide antibodies. You have to do a whole big deeper dive on that. And one of the things that I find is kind of strange is that the TSH normal range is 0.45 to 4.5. I mean, that's a huge range. And, one of the things I've learned in functional medicine is that ideally we want that range between like zero point 0.8 and 1.2, 1.5. We want the TSH low. TSH and thyroid are like inverse. It's like a teeter totter. If your thyroid is low, your TSH will be high because it's saying, hey, thyroid, I'm stimulating you to kick out some thyroid. And if it's the reverse, your TSH will be low and your thyroid will be high. You want to find that balance somewhere right in between, where that people can have a TSH of 1.2, 1.5, and then the thyroid levels are active, and they might look a little bit high compared to normal labs, but people feel better. They have more energy. Um, they sleep better. They have better bowel movements, better gut health, better like I said, energy, and kind of get up and go. And they tend, if they were hypothyroid, they tend to lose a little bit of that resistant weight. Um, and like I said, they have more energy and they just feel better. So that's one of the things that I found really tricky and interesting in comparing Western medicine labs and functional labs.
So let's say about the thyroid. Do you believe in hormone therapy? I know in some cases we have to follow for hormone therapy, but what about the rest, like with
Oh,
thyroid?
absolutely. If you need hormone therapy, sometimes you need it. I mean, obviously, someone's had their thyroid taken out because of cancer or something bad, or it just doesn't work. They could need thyroid therapy. But again, functional medicine is root cause medicine. Like if you're, I had someone ask me today, what does functional mean? And I had to think about it for a minute, and it went back to something that I listened to Mark Hyman. He talks about. He's like, as a functional medicine doctor, we have to know biochemistry, and what we're trying to get functional is all the biochemical pathways in your body. Again, health is multifactorial. If your gut health is bad, your hormones can be bad. If your gut health is bad and you have low nutrient absorption because you have celiac or you have intestinal permeability, you're going to have that generalized inflammation. And what can happen is that suddenly your thyroid might not be working well anymore. And I like to explain to people, when you have intestinal permeability, the first thing you have is decreased nutrient absorption, right? Then you have the low level chronic inflammation, which then stimulates your immune system to kind of go in hyperdrive and overdrive. And by a mechanism called molecular mimicry, because your immune system is in overdrive for 6, 7, 8, 15, 20 years, this mechanism called molecular mimicry, your immune system can look at your thyroid or your pancreas and say, hey, you know what? Those cells look a lot like the ones that we've been attacking here recently. And then they will go and attack that thyroid cell. And so then you can become hypothyroid because of an autoimmune disease. It's Hashimoto's autoimmune thyroiditis. And so if you can reverse leaky gut, intestinal permeability, quell the immune system, this smoldering fire, oftentimes you can reverse autoimmune disease, thyroid disease. Like a lot of these diseases are totally reversible. And, sadly, most patients have never heard their doctor tell them, "Oh, we can reverse this disease."
Yeah.
A lot of my clients will ask me, what are the causes of leaky gut? And unfortunately, I'll tell people straight up. I said, if you eat the standard American diet, you're going to have intestinal permeability because it's so toxic to the gut lining. Then there's other things like antibiotics, which can cause microbiome dysbiosis and imbalance. Too much stress can actually cause intestinal permeability. Too much hard exercise can cause intestinal permeability. The number one thing, alcohol can do that as well. The number one thing that most people have heard about is gluten. And, gluten has two proteins in it, a glutenin and gliadin, and those really can damage the inside lining of the intestines and um, cause like severe intestinal permeability. And then, another thing is legumes, lectins, which are found in, nuts and seeds and some other foods. But the biggest thing is, and what, like I said, most people have heard about is gluten. And that's, if you have celiac disease and you eat gluten, you're going to be very, very sick. So
Yeah. Actually, what you're saying is the cause of many, many disease. So that's why we use functional medicine, because it's a root cause, as you said. So let's say if you, even if you feel tired and you have a lot of fatigue in your body, you don't know the root. So as I said, you may have it for God, or it may come from your detoxification issues. So let's say somebody come to you with some gut problem. What kind of detoxification do you recommend to them?
well, first of all, I'm gonna, the biggest thing is you got to remove the offending agents, right? And so I'm gonna ask people that they remove my three big no nos are gluten, dairy, and sugar, and then we can do a liver detox. You can do I'm a big fan of dandelion tea. That really helps detox the liver and the bile duct system. And then you can also do, steam showers, saunas, and then you can also take actual um, detox supplements that help you detox as well. Because one of the things that we have to do is like I said before, health is multifactorial. But another thing I've really started telling clients is it's also very cumulative. Um, it's multifactorial, and it means it can be affected by this, and this, but it's also cumulative. If your body's genius. I mean, I cannot believe how genius the human body is, and it has so many redundant systems to try to stay healthy. And but it's a cumulative effect of, if you can only poison it so much until it says, throws its hands in there and says, I've had enough, and then all of a sudden you get some sort of disease.
The body tries to get back to homeostasis, and then but the problem is, after sometimes when we abuse the self medicating or self care, because what happened, um, the body has the power to self heal, to self healing. But the problem is, we think that, oh, this is nothing, everything gonna be okay. And then we don't try to find the root cause, then it's gonna hit us, and then we're gonna have a lot of symptoms later, and it's difficult to get back to balance again. Yeah.
Absolutely, I agree 100%. And the homeostasis is, it's that's where the body wants to be. It wants to be in a state of you know good health and wellness. And it's I think it's actually very rare that people have chronic disease. It didn't used to be like it is today. For the last 300, 400, 500,000 years, the main cause of death was infectious disease, because then you would catch a bug of some type and then you would die. Well, today, unfortunately, the main causes of death in America are by non communicable diseases, meaning diabetes, heart disease, cancer, stroke, kidney failure, autoimmune disease, and so on. And it's all because of the cumulative effect of us, of the toxins that we're experiencing every day, every day, every day, including in our food. So,
And what I realized sometime, let's say because I'm doing a fertility consultation, and some people in some stage come to me and they have a lot of problem in their body. I will ask them not going to IVF before cleaning their gut, cleaning their uh, liver, and try to be healthy before even going to IVF or other treatments. uh, some of them give up because they don't believe in holistic medicine. They say, oh, that's fine if I have some problem with my gut. This is not related to fertility or something like that. So what happened in later stage in their life, I see them and they have other problems, right? So in one stage of your life, because fertility is very tricky, if your reproduction doesn't work, it means there is something wrong in your body and you have to remove that, not because you want to get pregnant, because your body needs to be healthy and in balance, right? So later on I visit them and I see they have early menopause, they have Hashimoto's, they have thyroid issues. You see, that's interesting because in one point you have to prevent, you have to say enough is enough. I'm gonna get back to balance. I'm gonna remove all the problem. So at least if you cannot remove all the problems, at least you can find some healing opportunities to get back to balance, right?
for
Yeah.
sure, 100%. And again, it's multifactorial. Not It's not just one thing normally that's causing people to have disease. It's usually uh, everything in your lifestyle. It's maybe too much drinking, not eating enough whole healthy foods, not exercising, not getting enough sunshine, not you know having anything for stress relief. I was talking to a gentleman this morning, and talking to kind of explaining how my my new patient intake is 90 minutes, as compared to Western medicine intake is what, maybe 30 minutes, and maybe a 7-minute doctor visit the next time. And what I do in functional medicine, I ask people about, like, what do they eat. I ask people, do you eat you know gluten? How much sugar do you eat? Do you drink caffeine? How much rest do you get? Do you sleep well? Do you have a good way to reduce stress? Do you have a good social support system, whether it's your family, your church, whatever it is, your work? And so I've seen a really funny meme that says, if your doctor prescribes a drug for you without asking you any of these questions first, then your doctor's just a drug dealer. So, and I
That's
find it
funny.
funny, but I mean, that's really what we have to do. We have to have a shift now in medicine. We have to ask all these things, because sickness and health, they are multifactorial. I mean, I can say that over and over and over again because it's so true. And so, if you're going to see a doctor, for any of you people out there, and they don't ask you about these things, ask them to ask you about them.
Robert, I've seen a movie that's a series, and it's about trauma. ER doctors working in trauma section in ER,
Hmm.
and I've seen it's very very important. I've never seen this before because the traditional, very traditional one, we didn't have trauma doctors, right? So in ER, when you see people coming with a lot of depression and whatever, not only the physical injury, but they have a lot of hidden stuff inside the body, and then they go through them, and it's very essential to have this in this system, as you said.
For
Yeah.
sure. And one of the things that isn't really talked about is adverse childhood events. Whether it's um, trauma, abuse. Growing up in a very, very unhealthy environment with maybe only one parent or no parents, or anything can happen. And they've done studies that show that these adverse childhood events lead to increased chronic disease, increased drug addiction, increased alcohol abuse, increased self-medication. And that's one of the things that isn't really ever even discussed with most Western medicine doctors. Like, I ask my
Yeah.
clients, have you had any bad childhood events? Tell me about your childhood. Tell me about your birth. Tell me, were you breastfed? Were you bottle fed? Did you have a good childhood? I mean,
Yeah,
they're
exactly.
all,
Especially in asthma. It
yeah,
really is not only puff because I had asthma. So I see that it really affect to have if you had a trauma before, it really affects your body and your breathing.
for sure. Absolutely.
Yeah,
And, again, it's just like if you have the intestinal permeability and you have chronic inflammation. And when I say leaky gut leads to chronic inflammation, I don't mean just here in your gut. I mean fingertip to fingertip and head to toe. Um, and you can have that chronic inflammation. It's a low grade chronic inflammation. But then if something else affects you, like asthma or allergies, or you get another infection, you have less resilience to fight that off because your immune system's already working so hard.
I
And so
like
one of
that.
the things I've really noticed in my own life is I grew up, really having bad allergies. And when I fixed my gut, my allergies kind of went away, which is amazing. Sorry about this. I can't turn this off.
No worries. So
um,
here I can see that you have some websites. You, I just want to mention about this because maybe our time is up. The paleomed.com, and then you have trimdownpowerup.com, BZ General, and these are your for webinars and your website. You also have a Facebook and Instagram as well.
Absolutely. Yeah.
Um, your
The
video name.
paleomd.com is my website. You can find information there, some good blogs, some great information. The trimdownpowerup.com is the landing page for my webinar. I have a webinar because I have a 12-week lifestyle transformation course where I help people transform their lives and come away from this paradigm of the chronic disease from the standard American diet. It's an amazing course. If I say so myself, I've had a lot of great results from it. Again, it's a 12-week course. Everybody gets, you get 144 meals delivered to your door. You get supplements that I've hand chosen delivered to your door. You get fasting supplements delivered to your door, learning modules, and then there's a weekly Zoom coaching call with me for the program. And it's really, really helped transform a lot of people's lives, help them lose weight, help them reduce the burden of chronic disease, come off medications. And then on my Facebook, the Paleo MD on Facebook and the Paleo MD on Instagram, just some other great places to get more fun information. I kind of have
Thank you so much. Thank you. Please subscribe to Panta Calhoun Transition channel and order my book Needs Gap through Amazon. Simple guide to manage autoimmune disease and chronic pain.